if someone's a laser eye surgeon and they're trained on how to use the equipment, why do they need to know the physics behind it or what you know? Like how has it helped you to know both the medical side, the clinical side, plus the instruments themselves and exactly how they work?
Yeah, very good question again. For most of the doctors, because they've never had a formal laser in-depth training, the laser machine they use is like a black box to them. They use it to do the surgeries on patients' eyes. But the problem is, sometimes when things are not going well in the laser machine, you don't know whether, can be fixed or can be able to fix it. So I want to be able to take care of my patients and offer the best possible surgery, which is laser. For example, cataract surgery, only 5% of cataract surgeries in America are performed with laser. The other 95% remaining are still with a blade. And so I wanted to, not only my adapting the latest technology laser, also helping all doctors improve the technology, the weak area technology. So I enjoy doing that because I think I want to share and I want to pay back what I've benefited as an immigrant coming to America, a country that offered me the opportunity and pursue happiness, and I'm grateful.
So did you feel like you got better outcomes than other laser eye surgeons because you knew, the technology so deeply?
Yes, because all surgeons, almost everyone, the laser is a black box. So when laser is not properly functioning, sometimes doctor didn't even know, you know what I'm saying? And then you create irreversible, treatment result on your patients, which cannot be reversed. So I think
I've heard some laser eye surgeries, when they go wrong, they'll create a prescription for the client that's unfillable, or they'll see glares, or they'll have other problems that are, it fixes part of their sight, but there's a terrible trade-off where now they have other problems that can't be fixed.
Yes, we need to know medicine is not perfect, and, but with medical training and the laser training, which is very rare. I'm probably the only laser eye surgeon in the world who has an MD and a Ph.D. in laser physics. That does give me the opportunity to understand what's going on with the laser. And I formulate every single treatment plan myself. Every one of the 55,000 laser vision corrections I've done, always customized the machine to each individual patient. I have never have to perform the same surgery. Among the 55,000 surgeries I've done, Richard, over 4,000 were other doctors. So I've been very happy with that because it shows the medical, establishment trust in my work.
Did you become known as like the person to go to, absolutely have to get it right? Did you take on like tough cases other people couldn't take on? Like, what happened?
Yes. I'm known as the doctor's doctor because I perform among the 55,000 surgeries, over 4,000 were on other doctors. And we have a clinic to deal with complications that's sent to us often by doctors from around the world to deal with those tough surgical outcomes. So
that's really cool.
Yes.
How did you feel, let's say 6 months into it or a year into it, as you were doing these surgeries and getting these results? Like, did you feel a sense of relief or accomplishment, or like where was your mind at as you started doing these? Did you feel like you were fulfilling your purpose, or how were you mentally?
Yes. I mean, I work hard, and people sometimes ask us, why are you working so hard? The answer is very simple. I say, if you also have experience once or having nothing, having not, you would want to work hard also, because you appreciate where you have more. And so I sharpened my skills in laser vision correction and performing. Oh, by the way, Richard, do you know that LASIK eye surgery is going out of date?
What do you mean going out of date? Is it being replaced by something new?
Yes, replaced by a new procedure called small incision LASIK or SMILE. And small incision, safer, less dry eyes, less complications. However, despite the fact that small incision version of LASIK is replacing the traditional LASIK, still 95% of doctors in America today are not using SMILE. Are still using the older technology. And
why is that? They feel like it's not robust, or what's the reason?
No, it's people are creature of habits, and all the practicing doctors, they were trained with blade in their residency. So they feel like they don't want to change. It's not that they cannot learn, but they just don't want to learn. And also, honestly, for medical doctors who've gone to medical school, they don't have in-depth knowledge about the laser physics and engineering. So to them, it's some area they don't necessarily want to. Otherwise, they have to. So most of them stay doing the blades.
Okay. Then how did you feel, again, personally about yourself and your life? And, did you feel like you were doing what you were meant to do? How did you feel early on? And were there any frustrations even early on when you were doing this?
I think I'm doing exactly what God want me to do, because after becoming an ophthalmologist, I pray to God. I said, what is I need to use my long, hard-learned skill for? Richard, can you guess how many years I was in school to study all this stuff? 31 years.
Oh, wow. Yeah, you said you came in 82 and by 91 you had your credentials, which is still not a lot of time.
Well,
PhD and an MD.
Yeah, I didn't finish all the studying training until 1997. So if you start, 6 years old, elementary school, that was 31 years. If we're starting freshman college, that was 20 years.